There are now more than 118,000 cases in 114 countries. We have therefore made the assessment that COVID-19 can be characterized as a pandemic.
The coronavirus is the biggest threat this country has faced for decades.
This is a message from the nurses at Gloucestershire hospitals. Please stay at home.
We are prepared for this. We have rehearsed this, albeit not of this scale. None of us have experienced something like the times ahead. We're going to all have to work differently over the coming weeks and months. Clinical staff are going to need to be upskilled in the care of patients with respiratory illness.
The time has now come for us all to do more. You must stay at home. I want to thank everyone who is working flat out to beat the virus. Everyone from the supermarket staff to the transport workers to the carers to the nurses and doctors on the front line.
There are indications that the measures that we put in place have been successful in slowing down the spread of this virus.
We are planned, we are prepared. The amazing amount of work that people have done. We've flipped this trust in about 3 weeks. However busy we are today, we're going to be at least twice as busy in 7 days' time, and that's what we need to expect.
What is it like this turbulent time in the trials of COVID-19, while your family and friends are hidden away, nowhere to be seen?
It came without warning from faraway lands, with no respect for our own personal plans. We do our jobs with kindness, respect and with care, wearing uncomfortable PPE, you can hardly get air.
When we get to the edge, we will be ready. When it's time to jump, we will fly. We've got this.
Walking away from someone that you love who's very, very unwell and driving home at 1 o'clock in the morning, really, really upset and not getting a wink of sleep because you're waiting for the phone to go.
We should take comfort that while we may have more still to endure, better days will return. We will be with our friends again. We will be with our families again. We will meet again.
The supportive care team is being put together now and will hopefully be contacting you and your pods in the next few days.
We cannot take away the distress of not being with loved ones at the end of their lives.
But we can do everything in our power to never forget.
Every name is a person.
Every person is a life lived.
Every life a story behind it.
Whilst we may have little time to get to know each person,
we will provide comfort and endeavour to ensure that they are not alone in their final moments.
Some of our staff are actually superheroes underneath too.
I don't see it as being courageous. Every year that I've been a nurse, I've done the same thing. This is no different. It is scary, it's frightening, but we would all just make the decision to just do our job.
I'm immensely proud working for the NHS and doing what I do on a day-to-day basis. In the morning, we feel fear and anxiety like everyone else. It's a new normal for us in this pandemic. Fear and apprehension is not a sign of weakness. It's what makes us human.
We are now making progress in this incredible national battle. I've seen the personal courage, not just of the doctors and nurses, but of everyone. The cleaners, the cooks, the healthcare workers of every description, physios, radiographers, pharmacists, who've kept coming to work. It is thanks to that courage, that devotion, that duty, and that love that our NHS has been unbeatable.
Thank you for supporting our mums, babies and families in Gloucestershire.
With transmission significantly lower, we must stay alert, control the virus and save lives.
When I think of the innovation, the professionalism and the compassion that a Gloucestershire nurse has, I'm really proud to count myself amongst you. Thank you for your skill, your talent, your kindness and your compassion. Today, we're celebrating each other.
Even with COVID, normal illness exists. If you're worried, the NHS is here for you.
One of the things that's really touched me is our community support. We have engineers, entrepreneurs, all sorts of people in the community in Gloucestershire who have been supporting us, and it's just truly incredible.
They've done the most remarkable things. You can tell by all the people coming out every week to clap.
I don't think we can say thank you often enough to our volunteers
for all that you do.
Over the coming months, people will still see personal protective equipment as a key piece of their armoury in terms of keeping themselves safe, but also the patients safe.
How do we pause and take a moment to commemorate, remember that we as staff have gone through quite a difficult few months, and we want to remember those lives that were lost, and we want to remember those lives that were saved.
Many of the requests that we're facing at the moment are labour intensive, and as such we need to have the flexibility to put the staff where the workload is.
Face coverings should be mandatory, giving people more confidence to go on public transport and to a hospital setting when they need to.
It's been a marvellous opportunity just to have a chance of seeing people who I know have been doing so much literally on the front line.
We couldn't have done it without you, so I just want to take the opportunity to thank you and to wish you well with the celebrations of our annual Healthcare Assistance Day. Thank you all so very much.
As we continue to face the biggest challenge the NHS has faced in its 72-year history, it's right to pause and reflect and recognise the tremendous commitment and dedication by all our colleagues that have cared for patients and carers and families so well during these very difficult times. I would like to thank all staff for everything that they do and wish us all a very happy 72nd birthday.
Happy birthday, NHS!
The way they've looked after people, the way they've sort of kept control of the whole thing, you know, it's a question of not panicking and getting on with it. They are Britain at its best.
Being a volunteer is all about giving, and you give so much. You give your time, your energies, your gifts, your love, very often your emotion as well.
Something would happen that we weren't expecting and we responded. And it's just an amazing testament to the team here, what we've done over the last few months.
A year like no other, unexpected and unprecedented. A year when I couldn't be more proud to be part of the Gloucestershire health and care system. I couldn't be more indebted to my colleagues for their individual contributions or to their families for supporting them. Or indeed more grateful for the extraordinary shows of affection and support from our local communities. Gloucestershire's response to the pandemic was nothing short of magnificent and touched all of our lives in different ways. We suffered the same storm, but often in different boats. My colleagues worked extraordinary hours in challenging situations. Some of them lost their loved ones. Sadly, we're likely to face some of these challenges again. However, we go forward knowing what we are capable of, having learnt lessons from the first phase and having become closer as both friends and colleagues. So, whilst we may not be clapped on a Thursday evening or blessed with goodie bags, let's not forget that we've still got this.